dead. 2 months old, the youngest of 8 children. She was a casualty of poverty, another mouth to feed in a family where already there was too little to eat. She died of protein deficiency and malnutrition, and her father, who worked in another town, did not come to her funeral. He could not afford to make the trip. This infant's death is not unique. In countries throughout the developing world, the death of little children is one of the daily tragedies of life. Though we usually think of the problem of an exploding population in terms such as economic development, overcrowding, underemployment, ecology, education, maternal health, and personal freedom, it has come down, for these people, on this day, to a matter of life and death.
Children dying from starvation in underdeveloped countries and children dying in the wars. There is not much difference. They are both murder. I'm scared about the population in the whole world, but especially in El Salvador, which is the place where I live, where my children are, my wife, my work, everything. And I'm scared, of course. That's why I'm working here.
Is it desperate? Do you think it's
Yes. I think it's desperate, the situation, but somebody has to do something. We have to do something. And when I say something, I am complaining because I want a very strong and aggressive policy in population. If this country is going to be a country, a livable country within 20 years.
El Salvador has the highest population density in Latin America and one of the highest population growth rates in the world. There are 3.5 million people here now, and if something is not done, there will be 7 million in 20 years. Already one can see what this might mean in terms of human degradation. Although El Salvador does not have an official population policy, people like Dr. Madrigal are working to meet the challenge. But in the meantime, human tragedies occur.
I can't tell you what my name is, or show you my face, or tell you the name of the hospital we are in. But I really want you to see this. It's terrible. This girl is Anne-Marie, and she's been here for about 6 weeks, laying very close to death from an illegal abortion. This is not a unique case. We have more than 60,000 cases like this a year in this small country alone. As a doctor, I feel that if family planning services were more widely available, tragedies like this would never happen.
The great number of illegal abortions throughout Latin America and the risks taken by women who seek them is powerful proof of the desire by these women for a way to control the size of their families. Dr. Vernon Madrigal wants them to have an alternative to butchery. Among his many interests is female sterilization.
This lady is a 32 years old lady. She's had 6 children, ages from 11, I think, to 5 years old. And she's been taking pills in the last 5 years. But she's so nervous and she's so anxious about the problem that she decided to ask us to sterilize her, and we're doing it with a new method called laparoscopic Cuba ligation. I am the grantee of Pathfinder, so we're working for the Asociación Demográfica, and Pathfinder will provide the funds to do 300 Cuba ligations in 1 year.
Ok, dame un poco más de gas, que está muy bajo el...
She is under local anesthesia. She's not under general anesthesia, which represents a great advantage because the lady can be operated with local anesthesia and then go home in 4 hours.
Dr. Madrigal got his laparoscope from the Pathfinder Fund, an American foundation concerned with population in developing countries. Along with Pathfinder and other groups, the Agency for International Development, AID, the largest source of assistance and funding in the field, is helping in an international assault upon the most pressing problem of the 20th century.
Okay.
Pero es de mucha importancia tratar de ayudar a las personas que lo necesiten.
Ah, tiene razón. ¿Y esta familia qué tiene?
Aquí hay un caso de gastroenteritis, el que voy a visitar.
Ajá. Bueno, muchas gracias.
Adiós.
Some places in El Salvador are very difficult to get to, but getting there is part of winning the battle in health and family planning. The nurse that I came with came because there's a problem of health in the family. After she tries to resolve this problem, she will talk to the family about preventive medicine and family planning. AID is supporting her in this effort.
Entonces, este organito que tiene forma de pera, aquí adentro y que está
Sex
abajo del
education is an important part of the population program in El Salvador. In a few years, these children will be in the prime reproductive age group, and then will have the knowledge to make intelligent decisions about family size.
Este ombliguito, salen aquellas dos tripitas.
On the other side of the world, the governor of a Philippine province spends 30% of his time talking about family planning. Like Dr. Madrigal, Governor San Luis is convinced that unchecked population growth is the greatest threat to his country. In the Philippines, one finds the problems of El Salvador reflected on a huge scale. In 1970, the government established a population policy. The result? In a short time, the Philippines has developed a diverse, far-reaching family planning program, potentially one of the most effective in Southeast Asia. With help from international agencies, a large input from AID, and the energetic efforts of Philippine officials and volunteers, the challenge is finally being faced. Is it too late? No one can say for sure. The traditional agricultural economy is giving way to industrialization. The country is in the throes of a vast migration from farms to cities. Manila is overcrowded and mired in smog, and its Tondo slums are among the worst in the world.
Our statistics show today that more than 70% of our people belong to the poverty line, live within the poverty line. I know for a fact that there are 1.5 million families in the Philippines who live below the subsistence level. And with the present growth rate of 3.1 of Philippine population, you can just imagine how disastrous this would be for the future of our social and economic development.
As a Peace Corps volunteer here in the Philippines, you see many different developmental projects, and there are projects in agriculture, education, infrastructure, and yet all of these projects are diminished because of the vast population problem in this country. So I feel as a volunteer working here, it's been very rewarding to be in this kind of program that's at the crux of the matter.
What to hear, for the Lord up above.
Children, too, are at the crux of the matter. In a class on population awareness in an elementary school in Cabanatuan City, second-grade students play a game. How many of them can fit into a limited space before the overcrowding becomes unbearable? How far can they be pressed before the game suddenly becomes unfunny?
God created man and all the beings in this earth, and by nature we're all selfish as God has created us. And it is one of the things that God has given us in order that we should be able to survive. So every man by nature is selfish. And in our family planning program, we are exploiting the selfishness of man in order that we can push through our family planning program. Why? Because we know very well that over and above the laws of God, the laws of society, is the law of the stomach, which is one of the expressions of selfishness of man, the law of the stomach. So if you go to the barrios and tell the people there in the barrios about, oh, you can help the world, your country, by embracing family planning, they would not listen to you. But you tell them, you help, if you embrace this family planning program, you'll be helping your children, in order that they will not be undernourished, in order that they will be able to go to school, so that you can give them a higher degree of education. It will be a very effective way, much more effective, and that is what we are learning.
When Governor San Luis began his family planning programs in Laguna, he met resistance from the Catholic Church. Now the Responsible Parenthood Council, a Catholic organization, is working on population. Volunteer couples visit people in their homes to discuss the rhythm method. In Cavite Province, Commander Borgia and his wife have made more than 50 such visits. How are they doing? Pretty good, says the commander. So far, nobody's pregnant. The home visit approach to family planning has no national boundaries. In the mining town of Bomi Hills in Liberia, Philip Khoikhoi has been a professional visitor for 4 years. In that time, he's called at house after house on behalf of the Family Planning Association of Liberia, explaining to parents how they can restrict the size of their families. Later, many of these people have shown up at the Bomi Hills Clinic, which dispenses a large assortment of birth prevention devices. Liberia has a relatively small population and is not yet embroiled in a population crisis, but the infant mortality rate here is high, and mother-child health care is below an acceptable standard. Though the government has no official population policy, the Family Planning Association of Liberia, a private group supported by the International Planned Parenthood Federation, supplies family planning services for those who wish them, emphasizes the health and welfare of mothers and babies, and instructs women on the proper spacing of children.
Put 3 scoops of lactogen in here, and you fill it up, water up to 6 ounces. That's how much the baby's supposed to have, okay? Now make sure the water is boiled. And before you come to feed the baby, you wash your hands.
Mr. William Hill, Administrative Secretary of the Family Planning Association of Liberia, came to the University of Chicago to study advanced techniques in population communications. Mr. Hill's training in Chicago is part of a huge effort in manpower development, essential to the worldwide population movement. Over the next 10 years, the movement needs more than 50,000 physicians, 150,000 nurses, 100,000 health and family planning home visitors, and thousands more medical and social workers, health and family life educators, demographers, behavioral scientists, and communications and training experts.
The interesting part. If it's a face, as it is a front face, you should have the eyes in the middle. If you look at
India. After mainland China, the most populous country on earth, over 500 million people. If the growth rate is not checked, there will be more than 1 billion people by the year 2000. The effort here has been enormous. the oldest and one of the largest official family planning programs in the world. 20 years of labor by hundreds of thousands of people. The goal? Lower the birth rate by 40% over the next 10 years. In India, they use the cafeteria approach, making a wide range of birth prevention methods easily available. Sterilization, intrauterine devices, condoms, and other conventional contraceptives, including pills in selected projects. However, sterilization is the mainstay of the program. In the city of Kannanur in Kerala State, one of the great innovations of the Indian effort, a vasectomy camp, an intensive campaign to perform more than 15,000 operations in 30 days.
This is where all the people come for the vasectomy operation. Here, please go on. See. Now we go to the control room. See, this is the control room where all the activities are controlled. Actually, this is the nerve center of the camp. These are the officers responsible for the camp. District Family Planning Medical Officer, DMO, Mr. Tampi, and Deputy Collector. Here we find all the people lined up for the operation. You see, they are coming from all over the district, and not only from this district, from other places also.
Shankaran.
His name is Shankaran. He is 38 years old. He says he has 3 children. His wife is 30 years old. Why do you come here?
Operation.
He says he doesn't want any more children. He has 3 already. നിങ്ങൾക്ക് ഭാര്യയുടെ സമ്മതമുണ്ടോ ഓപ്പറേഷൻ ചെയ്യാനായിട്ട്? He says his wife is willing, and he has no objection. Not that his wife have any objection for the operation.
The operation takes less than 10 minutes and can be performed with scarcely the loss of a single drop of blood. At one camp in Gujarat state, doctors performed the incredible number of 223,000 vasectomies in 60 days. There's a carnival atmosphere at the massive camps. Programs of live entertainment, songs and dances about the need for family planning, prizes, inducements, awards. One feels here that a whole people is behind this effort, that Indians regard family planning as a patriotic duty. In 1971, the Indian Parliament legalized abortion as a maternal health measure, part of a pattern of changing laws throughout the world. In Bombay, at the world's first hospital devoted solely to family planning, surgeons have devised a method of performing an abortion and a tubectomy at the same time. The Bombay program is the brainchild of Dr. Datta Pai.
You know, this is a fantastic station wherein more than 700,000 people pass every day. And it is here that the family planning history was made. In a city where there was only 1 sterilization per day, after setting up an operation theater here, we started doing 100, 200, 300 operations every day.
Centuries ago, Arab tribesmen discovered that if a small pebble is placed in the uterus of a female camel, that camel will not become pregnant. The Tunisian Institute of Family Planning and Maternal Child Health has chosen the camel, the first animal to practice family planning, as the symbol of its program and the bearer of an important message to the Tunisian people. Tunisian family planning officials meet with representatives of foreign agencies concerned with population. A doctor from the United Nations World Health Organization, a nurse midwife from the Swedish International Development Authority, a demographer from the Population Council, representatives of AID, and doctors, communicators, and demographers from other groups. There are meetings such as this in all the countries committed to population action. The challenge is worldwide. The response is international.
رأيي الخاص بالتنظيم العائلي
Standing in the courtyard of the great mosque of Kairouan, Imam Muhammad Ali Trad says that family planning is not contrary to Islam and that it is necessary for the economic development of the Tunisian nation. Religious leaders throughout the world are conscious of the population problem, and many of them have found that the idea of family planning is consistent with their religious principles.
في مسيرتنا الإصلاحية اللي نسعى فيها تو في تونس.
The role of women in Arab society is changing. Many have rejected their traditional role and now practice family planning. Dr. Ben Sheikh, a leader in the struggle for women's rights and the first female doctor in Tunisia, devotes all of her time to family planning counseling and clinical work. In Tunisia, as in many other countries, the postpartum approach has been extremely successful. Immediately following the delivery of a child, women are especially responsive to a visit by a family planning worker, providing information on contraceptive methods. But it is not enough to confine the work to clinics or to wait for people to appear. Family planning workers must visit remote areas, bringing information and services and a special kind of human understanding. The key to all family planning programs is the winning of acceptance. Will the women who are contacted accept the methods that are available? The approach is the same everywhere. In Tunisia, in South Korea, in every country in the world, one woman must talk to another. She must be sympathetic and friendly. The home visit in a rural area is like a ritual. A lonely walk, greeting, the establishment of rapport, the opening of a briefcase, the display and explanation of available devices. The women who do this work are a new breed of missionaries, and they often speak of their reward, the sense of personal accomplishment when they win another woman over, when they achieve the breakthrough called acceptance. South Korea, more than 32 million people, a rapidly developing nation that has reduced its growth rate by 1/3 in 10 years. The goal for 1976, another 1/4 decrease. On the streets of Seoul, one senses the dynamism and discipline of a people whose country has been transformed from rural to urban, from farming to an industrial power in a few short years. South Korea is one of the few success stories in the battle against an exploding population. And the Korean accomplishment is a valid inspiration to the developing world, where it was not easily achieved. The first-year birthday party of a male child. This is a traditional ceremony in Korea, where the preference for sons was long a barrier to family planning. But the country is changing. Urbanization is leading to a desire for smaller families. Women are becoming better educated. But the key factor is the commitment of the Korean government. It has taken 10 years of hard work to turn the growth rate statistics around. Faced by population disaster a decade ago, Korea has mounted an extensive program. Training, communication, collection and use of demographic data, a network of mothers' clubs for family planning promotion, and even the manufacture of condoms, as in this factory at Anyang.
Since 1965, the United States, through the Agency for International Development, has provided rapidly increasing support for population and family planning programs throughout the developing world. These funds, channeled through many organizations, now especially the United Nations, have gone for a broad scope of action, including research and the provision of contraceptives such as these, especially oral contraceptives, provided so that poor women and couples in the developing countries can control their fertility as they wish to improve their health and well-being.
The birth of a child is always a miracle, even to those who have seen it many times. In South Korea today, a birth is a more joyous miracle than in most developing countries, because as a result of an intensive program of family planning, the future of a child is far brighter. There should be no starvation for this Korean baby. The chance is good that he will have an education, a job in a dynamic economy, a decent environment, and perhaps most important, a sense of dignity. If such things can happen in Korea, then they can be made to happen everywhere. In Latin America, a child dies. In Korea, a child is born. Children are the future, and their destiny is in our hands. If the population challenge is met, then the future holds great promise. If it is not met, well, it must be met. Because when we speak of population, we are speaking of the future of the human race.